Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, report analysis, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service. 73050 Radiologic Examination, acromioclavicular joints, bilateral, with or without weighted distraction. This code applies when imaging both AC joints, regardless of whether weights are used or not, or if both weighted and non-weighted views are obtained. Here are the standard views typically performed in an AC joint series. Standard views: bilateral. AP view, frontal image used to establish baseline AC joint alignment. AP weight-bearing view helps assess ligament disruption by comparing joint space under stress. Axial Zanca view, optimized angle to detect subtle separation or displacement. These views help evaluate the coracoclavicular and acromioclavicular ligaments, which are key in diagnosing joint injuries such as sprains or dislocations. Radiology report: header, AP view of both AC joints with and without weights. History: left shoulder pain after fighting 1 month ago. Comparison: same-day chest radiographs. Findings: abnormal widening of the left acromioclavicular and coracoclavicular intervals, which increases under weight bearing. Coracoclavicular distance is 15 millimeters without weights and 21 millimeters with weights. No fracture or suspicious bony lesions identified. The right AC joint is within normal limits with and without weights. Impression: findings are consistent with a type 3 AC joint separation on the left. Further left shoulder views, such as an axillary view, may help define the extent of clavicular malalignment. Let's look at what was performed. Bilateral AP views without weights. Bilateral AP views with weights. This results in 4 total views, including both non-weighted and weighted imaging. However, view count is not the determining factor here. CPT code 7050 is selected anytime both AC joints are imaged, whether only without weights, only with weights, or both, as in this case. Let's choose the appropriate diagnosis code based on the clinical history and imaging findings. Report findings. State: this patient presents with left shoulder pain following a fight 1 month ago. The imaging shows abnormal AC and coracoclavicular widening, consistent with a type 3 AC joint separation. There is no documentation of prior AC joint imaging, and the chest X-ray comparison is performed the same day. Therefore, this represents the initial diagnostic encounter for this injury, and check the chart encounter to confirm this information. ICD-10-CM code for this report is S43.152A, dislocation of left acromioclavicular joint, initial encounter. This is the most appropriate code given: clear traumatic history, confirmed AC joint separation on imaging, no prior diagnostic shoulder exam. Correct codes for this case include CPT 73050, radiologic exam, AC joints bilateral with or without weighted distraction, ICD-10-CM S43.152A, dislocation of left acromioclavicular joint, initial encounter. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.